Hi, this is Dr. Wally Taylor from Forum Health and Texas Integrative Medicine, and I wanted to record just a short video to put out some important information that I hope will be of benefit to you. I'm basically reviewing an article that I just recently read that was the title of which was the endogenous deficiency of glutathione as the most likely cause of serious manifestations and death in, and I'm going to skip something here, but it's basically a term for viral infection in patients. Now, I've made videos in the past about glutathione and how important I think it is. And this is just another reason that I am finding that the use of glutathione is really critical in terms of protecting us. So for those of you that may not know, glutathione is 3 amino acids, glycine, L-cysteine, and glutamate that are hooked together. So it's what we call a tripeptide. It's actually a very small protein. But it turns out it's made by the body in pretty significant amounts, 24/7, 365. And it plays some critical roles in our body. But it turns out as we get older, glutathione tends to get depleted. And oftentimes in today's world, because we're confronted with so many environmental toxins, we're going around with deficient levels of glutathione. Well, what this article points up is that glutathione is really critical in our bodies. And of course, one of the main reasons that glutathione is so important is because it plays a very important role as an antioxidant. So our bodies, and especially when we have toxins and infections, creates a very large amount of these toxic substances that are called oxidative species. We sometimes call them free radicals or oxidative free radicals. And because they're able to damage our cells and our DNA and our tissues and lead to a whole host of problems in our bodies, we have some very important systems to try to neutralize those. Well, the most important one appears to be glutathione. And unfortunately, oftentimes it's deficient. So one of the things that we know glutathione does is it plays a very important role in neutralizing these toxic free radicals. Now, recently it's come to light that also glutathione plays a very important role in the expression of genes that we need to activate certain genes that will help us to make proteins that allow us to manufacture vitamin D, 125 vitamin D3, which is not really a true vitamin. It's actually a corticosteroid. So it's actually more like a hormone in our systems. But glutathione appears to play a very critical role in having normal vitamin D levels. And vitamin D, in turn, is also very important in supporting our immune system, especially when it comes to virus infections and control of inflammation. So without appropriate levels of glutathione, we have a lot of problems making normal levels of vitamin D. So in this article that I'll put a link in the show notes below on how you could access this article that was recently published, but it actually shows a hypothesis about the effects of having enough glutathione in your system for its role in prevention of viral infections and to reverse or reduce the likelihood of serious outcomes in the event of certain viral infections. So, some of you probably know that the amino acid L-cysteine, which contains a sulfur atom, is the rate limiting amino acid building block for glutathione. And so having enough L-cysteine in the body is pretty important. Now, you can take a supplement called N-acetylcysteine, sometimes abbreviated NAC or NAC, that can sometimes help support glutathione in the body so that you have more glutathione. But unfortunately, having high levels of NAC in your body doesn't always guarantee that your body's going to be able to convert that NAC into glutathione. So there can also be places for glutathione supplementation as well. Now, glutathione is not normally, we don't normally get a lot of it through our diet as glutathione. We do get the building blocks, the glycine, the cysteine, and the glutamate, but then we have to reassemble them in the body in order to make glutathione. So if we're trying to get glutathione in the body from outside the body by eating it, we typically have to play some tricks to make sure that it's absorbed adequately to give us enough high levels. One of those tricks is to take what we call liposomal glutathione. Another one is to take a form of glutathione that's called S-acetyl glutathione. This is when the glutathione molecule is modified by adding an acetyl group onto the sulfur atom in the glutathione. But anyway, I just wanted to get this brief video out to you from this recent article that was just published in late May by a group that showed that glutathione appears to play a direct role in protecting us from free radicals, and it supports the system that's called redox homeostasis, or basically the way that we control our reduction oxidation potential in our bodies and in our cells. So anyway, be aware of that. Be aware of how we might be able to support and maintain higher levels of glutathione, how the nutrient N-acetylcysteine may play a role in this, and that glutathione also plays a big role in maintenance of normal levels of 125 dihydroxy vitamin D3, which, as you know, is very critical for normal immune system function. I hope this is helpful. If it is, please share it with friends and family. Please consider following our YouTube channel for additional information that I'll try to be bringing out to you that might be of value in maintaining your health, especially in these times of danger that we're in. God bless.